Welcome to the PubMed Daily Review for May 18th, 2026. Today we scanned 704 new open access papers. Here are the top 5 selected for detailed analysis. Trend 1 of 5, Disease, Treatment, and Animal Health. This trend explores diseases, their underlying mechanisms, and therapeutic interventions across human and animal health. This cluster covers 178 papers. Representative work includes impact of dietary electrolyte balance on performance, inflammation, and gut integrity of lactating sow under heat stress, rabies in a dog commercially imported into Germany from Russia, 2026, and efficacy and safety of vonoprazan-based dual therapies with different antibiotics versus bismuth-containing quadruple therapy for Helicobacter pylori eradication. A prospective, 4-arm, randomized controlled trial. Trend 2 of 5. Complex clinical cases and reports. This trend highlights detailed reports and analyses of complex, rare, or challenging clinical presentations, diagnoses, and treatments. This cluster covers 141 papers. Representative work includes tension viscerothorax with concomitant pneumothorax and associated intrathoracic gastroperforation after thoracoabdominal stab wound in a resource-limited setting. A case report, high-resolution CT, based virtual simulation of an unruptured sinus of Valsalva aneurysm for aortic root reimplantation, a case report, and sensorineural hearing loss after transvenous embolization of a transverse sigmoid sinus dural arteriovenous fistula. Trend 3 of 5, Cancer Risk, Treatment, and Outcomes. This trend encompasses research on cancer risk factors, therapeutic interventions, and their impact on patient outcomes across diverse malignancies. This cluster covers 121 papers. Representative work includes association between metformin use and cervical cancer risk in women with diabetes in Japan, a retrospective cohort study, coexistence of primary colorectal cancer and multiple colonic metastases from pancreatic tail cancer, a case report, and transanal irrigation for low anterior resection syndrome treatment. International multi-center randomized clinical trial. Trend 4 of 5, Neurology and Brain Disorders Research. This trend investigates brain function, neurological disorders, their pathogenesis, diagnosis, and therapeutic approaches. This cluster covers 103 papers. Representative work includes time-dependent association between pre-hospital blood pressure and outcomes in acute spontaneous intracerebral hemorrhage, comparative effectiveness and safety of rituximab versus ocrelizumab in relapsing remitting multiple sclerosis, a Finnish population-based matched cohort study, and dual steric agonist for M2 muscarinic receptor causes oxidative stress and mitochondrial alteration in human glioblastoma cancer stem cells. Trend 5 of 5, Ecology, Behavior, and Policy Research. This trend examines behaviors, ecological dynamics, and policy effects across natural and human systems. This cluster covers 161 papers. Representative work includes head and whisker behaviors observed during foraging in northern elephant seals, Marunga angustirostris. Decline of common toad populations in Flanders is not linked to surrounding landscape, and gain curves, reproductive efficiency, and sex allocation. Up next, our first paper out of 5, 20-year results of the randomized European Organization for Research and Treatment of Cancer Trial 22922/10925, evaluating internal mammary chain and medial supraclavicular lymph node irradiation in stage I/III breast cancer by Orit Kaidar-Persson and Philip M. P. Portmans from Breast Radiation Unit, Sheba Medical Center, Ramat Gan, Israel. Let's break down its key contributions. For decades, the role of regional lymph node irradiation in early-stage breast cancer has been debated. While it aims to prevent cancer spread, concerns about treatment-related side effects have persisted. This study sought to clarify whether irradiating the internal mammary and medial supraclavicular lymph nodes truly improves long-term survival, especially considering potential delayed toxicities. Understanding this balance is vital for optimizing patient care. This was a large, randomized controlled trial, the EORTC 22922/10925, involving over 4,000 patients with early-stage breast cancer. Participants were randomly assigned to receive either IMMS lymph node irradiation or no such treatment. The study's strength lies in its remarkable median follow-up of over 22 years, allowing for a comprehensive assessment of both long-term efficacy and safety outcomes. Researchers meticulously tracked overall survival, disease-free survival, and specific causes of death. The results showed that at 20 years, overall survival was virtually identical between the two groups, with a hazard ratio of 1.00. However, a deeper dive revealed a significant reduction in breast cancer mortality in the IMMSRT group, with a hazard ratio of 0.82. Unfortunately, this benefit was offset by a significant increase in death from causes other than breast cancer, with a hazard ratio of 1.26. This increase was linked to higher rates of adverse events like lung fibrosis and cardiac diseases in the treated group. This study highlights a crucial point. While IMSRT effectively reduces breast cancer-specific mortality, its long-term side effects, particularly increased non-breast cancer deaths, ultimately cancel out any overall survival advantage. This means that for patients with early-stage breast cancer, the addition of IMMSRT may not provide a net survival benefit over 2 decades. The findings underscore the absolute necessity of very long-term follow-up in oncology trials to fully understand the complex interplay between treatment benefits and delayed toxicities. Up next, our second paper out of 5. An adipo-osteoprogenitor population in endosteal niche contributes to bone and fat formation in adult mouse bone marrow by Shuiyang Liao and Fanxin Long from A Department of Surgery, Translational Research Program in Pediatric Orthopedics, the Children's Hospital of Philadelphia, Pennsylvania, 19104. Let's break down its key contributions. Today, we're diving into a fascinating study that tackles a fundamental question in bone biology. What are the specific cells in our bone marrow that can give rise to both bone and fat? It's a complex environment, and identifying these precise progenitors is key to understanding how our bones are formed and how fat accumulates within them. This research aims to shed light on these elusive cells, which is incredibly important for future therapeutic strategies. To answer their question, the researchers employed a sophisticated approach using adult mouse bone marrow. They started with single-cell RNA sequencing to meticulously characterize individual cells, looking for unique molecular signatures. This was followed by advanced genetic fate mapping techniques, specifically using DRE and CRE recombinases to track the lineage of identified cell populations in vivo. This powerful combination allowed them to pinpoint specific progenitor cells and observe their differentiation pathways. The team made a significant discovery. They identified a small, distinct subset of bone marrow stromal cells co-expressing both adipoc and OSX. These adipoc plus OSX plus cells were primarily found in the endosteal niche, a critical area for bone remodeling. Crucially, their genetic fate mapping experiments definitively showed that these cells could differentiate into both osteoblasts, which form bone, and adipocytes, which form fat. This dual potential confirms their role as true adipo-osteoprogenitors. This research is incredibly significant because it pinpoints a specific progenitor cell population that contributes to both bone and fat formation. Understanding these adipoc plus OSX plus cells could open new avenues for treating conditions like osteoporosis, where bone density is lost, or even metabolic disorders linked to bone marrow fat. While this study was in mice, it lays crucial groundwork for future human research. Ultimately, these findings could lead to novel therapeutic strategies targeting these cells to modulate bone and fat balance. Up next, our third paper out of 5. Amyloid plaques ameliorate memory deficits and hippocampal neuron loss in an Aβ4/4-2-driven Alzheimer's disease mouse model by Sylvia Zamper and Oliver Worth from Psychiatry and Psychotherapy, University Medical Center, UMG, George August University, von Siebold STR, 5, 37075 Göttingen, Germany. Let's break down its key contributions. Alzheimer's disease is a devastating neurodegenerative condition, and a key hallmark is the accumulation of amyloid beta plaques in the brain. However, the precise role of these plaques has been a subject of intense debate, with growing evidence pointing to smaller, soluble forms of amyloid beta, called oligomers, as the main culprits behind neuronal damage. This study delves into a fascinating hypothesis. Could these plaques actually serve a protective role by trapping toxic oligomers, thereby mitigating some of the disease's detrimental effects? To explore this complex relationship, researchers utilized a sophisticated mouse model approach. They crossed 2 distinct Alzheimer's models: the TG4-42 HOM mice, which developed soluble Aβ4/4-2-driven neurotoxicity without plaques, and the 5XFAD mice, known for their abundant amyloid plaque pathology. This allowed them to create a new model, the 5xFAD/TG4-42 HOM, to study the interaction. They assessed memory using behavioral tests like the novel object recognition and Morris-Water maze, and also examined neuronal integrity and A-beta biochemistry in the brain. The results were quite intriguing. While spatial memory deficits in the TG4-42 HOM mice were not worsened by the presence of plaques, the researchers observed a significant rescue of recognition memory deficits in a combined 5xFAD/TG4-42 HOM mice. Furthermore, they found a reduced loss of distal CA1 pyramidal neurons in these mice, indicating a neuroprotective effect. Biochemically, there was also a trend towards increased insoluble A-beta-4X peptides in the hippocampus of the combined model, hinting at sequestration. This study provides compelling evidence supporting the hypothesis that amyloid plaques can act as reservoirs, buffering the toxicity of soluble A-beta oligomers. This challenges the simplistic view of plaques as purely detrimental and opens new avenues for understanding Alzheimer's pathogenesis. However, it's crucial to acknowledge the complexity of this interaction and that these findings are from a mouse model. Future research needs to delve deeper into the precise mechanisms of this buffering capacity and explore its potential therapeutic implications for human Alzheimer's disease. Up next, our fourth paper out of 5. Structural error, asymmetry, and harm-weighted analysis of ChatGPT versus ICU Physicians in acid-base interpretation. A prospective observational study by Derfel Galen and Ilkvi Seelan from Anesthesiology and Reanimation, University of Health Sciences, Bursa Yüksek Ataysis Training and Research Hospital, Bursa, Turkey. Let's break down its key contributions. Welcome. Today, we're diving into a critical comparison. How well does AI, specifically ChatGPT, stack up against experienced ICU physicians in interpreting complex acid-base disorders? While AI offers exciting possibilities, understanding its performance in real-world, high-stakes clinical scenarios, particularly when errors could have serious consequences, is absolutely vital. This paper addresses that very question, looking beyond simple accuracy to the nature and severity of diagnostic mistakes. The researchers conducted a prospective observational study in a single adult ICU. They enrolled 50 consecutive patients and had both ICU physicians and ChatGPT independently interpret arterial blood gas data from these real-world cases. The interpretations were then compared against a blinded expert panel's reference diagnosis. Beyond overall accuracy, the study meticulously analyzed agreement, sensitivity for complex mixed disorders, and, crucially, the clinical severity of any misclassifications. Let's look at the numbers. ICU physicians achieved an 82% overall accuracy, compared to ChatGPT's 72%. Interestingly, this overall difference wasn't statistically significant. However, when examining complex mixed acid-base disorders, ICU physicians had a sensitivity of 96%, while ChatGPT's dropped to 63%. Most critically, a harm-weighted analysis revealed that ChatGPT's errors carried significantly higher clinical severity, with a mean difference of 0.12 and a p-value of 0.026. This means ChatGPT's mistakes were more dangerous. So what does this all mean for clinical practice? This study highlights that while AI can perform reasonably well on simpler tasks, its errors in complex, high-stakes scenarios like ICU acid-base interpretation can be clinically severe, even leading to false reassurance. It underscores a critical point. Simply looking at overall accuracy isn't enough when evaluating AI in critical care. We need to develop and use safety-oriented and harm-weighted assessment frameworks to truly understand the risks and benefits of these powerful tools before they are widely adopted in clinical settings. Up next, our fifth paper out of 5. Base editing of Artemis mutations ex vivo sheds light on gene therapy for Artemis-deficient SCID by Ziwen Huang and Xiaochun Yuan from SYSU Institute of Advanced Studies Hong Kong, Science Park, Hong Kong, 999077 People's Republic of China. Let's break down its key contributions. Artemis-deficient SCD, or ART-SCD, is a devastating genetic disorder causing severe immune system failure. Current treatments like bone marrow transplant have challenges, and traditional gene therapies carry risks. This study investigates a promising new approach, using advanced gene editing tools to precisely correct the underlying genetic defects. Our researchers utilized a specialized 293T cell line lacking Artemis, along with AV-DJ recombination assay, to model the disease. They employed cutting-edge cytidine and adenosine base editors to precisely target and correct 3 specific pathogenic mutations in the Artemis gene. The primary goal was to see if these editors could restore the crucial Artemis enzyme activity and, importantly, to check for any unintended off-target edits. The results were very encouraging. We observed efficient editing, with approximately 50% correction for the C.181T greater than C mutation, and 35% and 20% for the C.49G greater than A and C.404G greater than A mutations, respectively. Crucially, these base editors successfully restored Artemis endonuclease activity in the deficient cell system. And a significant finding was the absence of detectable off-target effects at predicted sites, suggesting high precision. This study provides compelling proof of concept that base editing can precisely correct ART-SCID-causing mutations, offering a promising new therapeutic avenue. It addresses critical limitations of existing treatments, such as the challenges of hematopoietic stem cell transplantation and the safety concerns of traditional gene therapy. Moving forward, the next crucial steps involve validating these findings in more complex in vivo models and, ultimately, advancing towards clinical trials to bring this innovative therapy to patients. That's all for today's PubMed Daily. If you found this helpful, please leave a comment, and subscribe for daily paper summaries. See you tomorrow.